So, you've been diagnosed with a DVT. This is a blood clot that is in your leg. You probably already experienced some symptoms of redness, swelling, heat, and pain.
To diagnose a DVT, you might expect to have an ultrasound or a Doppler done of your leg. These both use ultrasound waves to detect where a clot might be. You may also have a venogram or an MRI. These both the venogram uses an X-ray waves and the MRI uses magnetic waves to detect where a clot might be. One more thing that might be done is a D-dimer, which is a blood draw. They test your blood to use that numbers used in that test to detect if there's a clot present.
What to expect to treat this is to elevate your leg. This will help with the swelling and the pain. To hydrate either orally or through an IV, and this will help open up your veins and arteries. This way blood can still get to the rest of your body. We'll also be measuring the area to make sure it doesn't keep swelling up, and also include a little bit of gentle walking. Throughout the process, we will monitor for chest pain and shortness of breath. This is so we can tell if the clot has moved from your leg to your lungs. This is called a pulmonary embolism when that happens. We will be avoiding massaging the area and wearing tight-fitting clothing and things that compress it.
So some things you might expect from the medical professionals outside of us nurses here is the doctor may prescribe you some medications to help break up that clot. If those medications don't work or you're not able to take those medications, they might have you go into surgery to remove the blood clot. An additional thing the doctor might do after removing your DVT would be to place an inferior vena cava catheter, which sounds big and scary, but it's a little cage device that they put into your inferior vena cava. They put a little needle up through your leg and they put it into your abdominal area. That's where your inferior vena cava is, and the cage opens and it stays there all by itself, and it catches any blood clots that might try to get to your heart or lungs. And the blood clots that get trapped in that cage there, the body breaks down on its own over time.
What to expect when you go home is to abide by a few things the doctor sends with you, which would be compression stockings. These compress your leg and make sure that blood clots don't form in it again. And also, he will prescribe blood thinners, and this is just to make sure blood clots don't form. And it is important to continue these because since you've already had one DVT, you're at a higher risk to have another.
Other things that might put you at risk for getting another DVT would be after any surgeries you may have in the future, if you were to gain weight and become obese, if you smoke or begin to smoke, if you have any injury to your legs, if you have cancer or are receiving treatment for cancer, if you take oral birth control, or if you have an inactive lifestyle.